My name is Carol Francis. I am a caregiver for my husband, Alfred Francis, whom I have cared for the last 20 years and who suffers from Alzheimer's disease. I have seen every stage of this disease unfold. I am my husband's strongest advocate. I make sure that the bar is set very high for him and his care. I set it high for myself, and I set it high for those who interact with him. I am a caregiver who does not leave my husband. I insist that I stay with him. My husband cannot speak for himself. He lost his ability to speak many years ago. Therefore, I must be his voice. I must see what you're doing to him, how you're doing it, and if it agrees with him. So therefore, I do not leave him. Let me introduce you to my husband. This is my hun, as I affectionately call him, Alfred. He has been a real trooper. I tell him all the time, he's a tough old bird. And I am just so proud of him because he has lasted 20 years and he has overcome the obstacles that have come in his path to still be here. I treat him with much love and the utmost respect. And I expect that everyone else that interacts with him will do the same. 20 years ago, when I discovered that my husband was ill, like everyone else, I was devastated. Somewhat in denial at first, and then realizing that this terrible thing was not going to go away. And so I pulled myself up by my bootstraps and I said, you know what, Carol? You have two choices. You can sit here and waddle in self-pity and stew, or you can educate yourself, see what this journey is going to be about, and make it better for him. I opted to do the latter. I still love him as much as I ever did. And when he looks up at me with those eyes, I know he's still in there. And so to be a part of something that makes a difference, like this patient and advisory council, I am privileged to give my input, to share my experiences in the hopes that this journey that Alfred and I have been on won't be in vain.
Mrs. Francis, tell me about your experience in March of 2009 when you requested to stay the night on my unit, and how did you feel?
Well, I felt challenged. I felt anger. And I was not pleased at all. However, I hold my ground. When it comes to my husband, I do not waver. And I am the type of person that would have slept in the waiting room had you not allowed me to stay. I always feel that if you speak well and make your point, that people will see that you're very serious. And so when I finished explaining that I was going to stay, why I was going to stay, I think that they came to the conclusion that it would be easier. You know, and as I pointed out to you in our discussion, I'm only here to help, not to hinder, and I knew that. But my main and first concern always is my husband, and I don't waver on that. If I couldn't have stayed, he wouldn't have stayed. When I was here in 2009, why did it make your staff uncomfortable that I wanted to stay with my husband?
In 2009, this was all a new practice. It had never been done before that families would stay the night. Nurses are taught in school that families go home. We're not used to having someone there watching over us as we do our tasks, as we provide medicine to patients. Since then, we've brought about some new things within the hospital, such as our AIDED program, which is where we explain to the families and patients who we are and what we're doing in the room, what our role is, what we will be doing with your family member. That way the family has a better understanding of why we're in the room. We've also started allowing families to stay the night. We have made more accommodations as far as single rooms, private rooms, so that families can stay and care for their loved one as they do at home.
Melva, as a caregiver, it seems to me that including families in the care would be the natural thing to do. But I understand that sometimes there are challenges that make it difficult for the hospital staff. Could you explain to me what are some of the difficulties?
So we're used to going in the rooms, providing patients their medications, doing dressing changes. We have a very scheduled system. So sometimes patients, I think nurses fear that patients and families would ask questions or somehow distract them from doing the task at hand. And sometimes they may feel that that is a barrier to getting that job done. Mrs. Francis, you have a lot of strength, and you tell people up front, you tell it like it is. What do you suggest for patients and families who don't have the strength you have, who don't feel comfortable speaking up and talking with their doctor about their concerns? What would you suggest them to do to include them in their care process?
I would think that when someone is a little shy, intimidated by all the processes, and don't speak up, that it would be the hospital staff that would then come forth and offer to their patient client what is available to them, how they can assist them. Some people need a little prodding, you know, and so I would think that then your staff would take the initiative to make sure that everybody was being treated the same.
Why do you feel it's important for families to be included in their care process?
Because I think there's nothing like TLC. We have a vested interest here. This is our loved one that we're caring for, so we should be their strongest advocate. And we know their strengths, we know their weaknesses, we know what they like, what they don't like. Your staff's not privy to that. And so that's where we can intervene and become part of the process. Also, every patient is different. Like my husband, he can't talk. He can't tell you what's hurting him or what he wants or what he doesn't want. You can't communicate with him. But if I'm there, I can help you get over that hump because I know him, because I'm his comfort zone. So that's how we can help with the whole process, rather than leaving you with a tug of war here. How has patient and family-centered care made a difference for your team?
I think they've learned. I think they've learned a lot since you were there in 2009. As I said, we've started several different initiatives around the institution, and they've learned. They see now that families are helpful. They help them to get their jobs done. They have less call lights. Our patient satisfaction scores have gone up. They see that this journey is the right thing to do. This is what we need to be doing throughout the country. Trust is very important to you. What are things that you look to establish trust in a relationship?
Respect. The fact that I'm sitting here, I'm his wife, that you come in and acknowledge me, present yourself well, your whole demeanor, you know. And I know we all have bad days, but you see, whatever's troubling you, I didn't cause. So I think you have to, in this profession, be the bigger person, set your moods aside, and realize how important your interaction is, and together, maybe we'll feel better if we communicate with each other. I think communication and respect build trust. Well, from my perspective, as an outsider, if we pull this together as it should work, we will only have success in the care, quality care of our patients.
Absolutely. Thank you for partnering with us.
You're welcome.